Hello everyone, I'm Dr. Ahmed Ezzat, an NHS surgeon. Today, I want to talk to you on behalf of BINHVA about a very serious topic, pancreatic cancer. This disease is known for its subtlety, making the recognition of its early signs crucial. We're not just talking about general health awareness. We're talking about knowledge that can save lives. Understanding these early indicators is our first line of defense. The statistics surrounding pancreatic cancer are alarming. It's one of the deadliest cancers, often diagnosed at a late stage. This underscores the urgency of early detection. If we can catch this disease early, the chances of successful intervention increase dramatically. That's why I'm here today to shed light on some of the subtle signs your body might be sending you. Our conversation today is about empowering you with information. We're going to delve into 3 specific, often overlooked symptoms that could indicate pancreatic cancer. My goal is not to cause alarm, but to foster awareness. Because when it comes to pancreatic cancer, awareness and swift action are our most powerful allies. Let's begin this important discussion. 16. One of the first subtle signs of pancreatic cancer involves changes in your blood sugar levels. This might manifest as erratic hunger pangs, a sudden insatiable need to eat. You might find yourself constantly reaching for snacks, particularly sugary ones. It's easy to dismiss this as stress or a change in metabolism, but it could be a sign of something more significant. Another indicator is the new onset of type 2 diabetes, especially in individuals who don't fit the typical risk profile. If you suddenly find yourself diagnosed with type 2 diabetes, this should be a signal to investigate further. The pancreas plays a pivotal role in regulating our body's blood sugar levels. It produces insulin, a hormone that allows glucose to enter cells and be used for energy. Without sufficient insulin, glucose remains in the bloodstream, leading to high blood sugar levels. When the pancreas is affected by cancer, its ability to produce insulin can be impaired. The cancer cells can disrupt the normal functioning of the insulin-producing cells. This disruption can lead to a decrease in insulin production or insulin resistance. Therefore, changes in blood sugar, erratic hunger, sudden diabetes, can be direct consequences of pancreatic cancer. It's crucial to understand that these symptoms are often subtle at first. You might not immediately connect feeling unusually hungry or tired with something as serious as pancreatic cancer. This is why awareness is so important. We need to listen closely to our bodies and question changes that don't have an obvious explanation. Think of your pancreas as a sophisticated factory. If something goes wrong, the entire system can be thrown into disarray. The erratic hunger pangs can be a sign that your body isn't getting glucose into its cells efficiently. The development of type 2 diabetes is a more overt signal that the insulin factory is failing. For individuals over 50 who suddenly develop diabetes without any other risk factors, this should raise a flag. Sometimes existing diabetes can suddenly become harder to control if pancreatic cancer develops. The relationship between diabetes and pancreatic cancer is complex. Any new or worsening diabetic symptoms should be taken seriously. The key takeaway is that your body's energy regulation system is delicate. The pancreas is central to this, and any unexplained, persistent changes in hunger or a new diagnosis of diabetes should prompt a conversation with your GP. These symptoms are not definitive proof of pancreatic cancer, but they are important pieces of the puzzle. The pancreas, tucked away deep within the abdomen, doesn't easily give up its secrets. That's why these indirect signs become so critical for us to recognize. If you notice these changes in yourself or a loved one, please don't ignore it. Early awareness can make all the difference. Your diligence in noticing and reporting these subtle shifts could be incredibly important for your long-term health. 34. Another significant early sign of pancreatic cancer is unexplained abdominal or back pain. This isn't just any fleeting discomfort, it's a persistent, dull ache that gnaws away. The pain is often located in the upper abdomen, sometimes radiating to the back. It might feel worse after eating a meal or when lying flat on your back. This is because the pancreas is located deep in the abdomen, close to major nerves and the spine. Many individuals find that the pain feels somewhat better when they lean forward or curl up into a fetal position. This specific characteristic should raise suspicion. If you're experiencing persistent abdominal or back pain that doesn't have a clear cause, it's essential to get this symptom investigated by your GP. The location of the pain can vary. Sometimes it's felt more centrally in the upper abdomen, just below the breastbone. Other times it might be more to one side. If the pain radiates to the back, it's often described as a deep, boring pain. This back pain can easily be mistaken for musculoskeletal issues, delaying the consideration of a more serious underlying cause. The persistence of the pain, its relationship to eating or posture, and the lack of a straightforward explanation are the red flags. Your doctor will be able to ask more detailed questions and consider whether further investigations are warranted. The pancreas sits nestled behind the stomach, very close to the spine, and a complex network of nerves and blood vessels. A growing tumor in this confined space can easily start to press on these sensitive structures, leading to the sensation of pain. The type of pain, dull, aching, sometimes sharp, often radiating, reflects this internal pressure and irritation. It's not uncommon for individuals to have sought treatment for what they thought was chronic indigestion or a slipped disc before pancreatic cancer is eventually diagnosed. This highlights how easily this symptom can be misattributed. The pain might start subtly, perhaps as a vague discomfort that you barely notice. But over time, as the tumor grows, the pain can become more constant and severe. It might interfere with your appetite, making you feel generally unwell. Remember, your body uses pain as a signal that something is wrong. While many pains are benign, a persistent, unexplained pain deserves careful attention. It's your body's way of saying, hey, something isn't right in here. Listening to that signal is paramount. When you see your GP, be as specific as possible about the pain. This detailed information helps your doctor build a clearer clinical picture. Don't try to self-diagnose or tough it out. Any new, persistent pain pattern warrants a medical opinion. 32. The third subtle sign of pancreatic cancer is jaundice. Jaundice causes your skin and the whites of your eyes to turn yellow. This yellowing is due to a buildup of bilirubin in your blood. Normally, the liver processes bilirubin and excretes it as part of bile. Bile travels from the liver through bile ducts, passes by the pancreas, and empties into the small intestine. If this pathway is blocked, bilirubin can't be excreted properly, leading to jaundice. One of the first places you might notice this yellowing is in the whites of your eyes. As bilirubin levels rise, the skin can also take on a yellow hue. This is a sign that should prompt immediate medical attention. In pancreatic cancer, jaundice often occurs when a tumor develops in the head of the pancreas. A tumor in this location can press on or block the bile duct. When the bile duct is obstructed, bile backs up, causing bilirubin to spill into the bloodstream. This is why jaundice is often an early symptom for cancers in the head of the pancreas. Alongside yellowing of the skin and eyes, other symptoms can occur. Your stools might become pale, clay-colored, or grayish. Conversely, your urine might become very dark, often described as tea-colored or dark brown. This is because the kidneys are trying to eliminate the bilirubin that the liver and bile ducts cannot. The combination of yellow skin and eyes, pale stools, and dark urine is a classic triad of symptoms pointing towards obstructive jaundice. Itchy skin, or pruritus, is another common symptom that can accompany jaundice. The exact cause of the itching isn't fully understood, but it's thought to be related to the accumulation of bile salts in the skin. This itching can be severe and widespread. While jaundice is a serious sign, its appearance can sometimes lead to an earlier diagnosis of pancreatic cancer. If you notice any yellowing of your eyes or skin, contact your doctor immediately. Jaundice requires prompt investigation to determine its cause. While pancreatic cancer is one possibility, other conditions like gallstones or hepatitis can also cause jaundice. Your doctor will likely ask about associated symptoms like pale stools, dark urine, itching, abdominal pain, and weight loss. They will perform a physical examination and order blood tests to check your liver function and bilirubin levels. Depending on these findings, imaging tests may be needed to visualize the liver, bile ducts, and pancreas. The development of jaundice is a clear signal from your body that a significant process is underway. The sooner the cause of jaundice is identified, the sooner appropriate management can begin. Think of the bile duct as a crucial drainage pipe. If that pipe gets blocked, the system backs up, and the visible manifestation of that backup is jaundice. A tumor in the head of the pancreas is like a growth constricting that pipe. Recognizing jaundice and seeking help quickly can be pivotal. It provides an opportunity for medical professionals to investigate and potentially find the cancer at an earlier stage. To recap, we've discussed 3 subtle yet crucial signs that could indicate pancreatic cancer: changes in blood sugar levels, persistent abdominal or back pain, and jaundice. If you or someone you know experience any of these symptoms, please do not ignore them. consult your GP as soon as possible. While these symptoms can be caused by other conditions, it's vital to rule out pancreatic cancer. Early detection significantly improves the chances of successful treatment. Your doctor is there to listen to your concerns and arrange further investigations if necessary. Taking that step is an act of self-care and responsibility. Unfortunately, there are currently no routine screening tests for early detection of pancreatic cancer. This makes awareness of these symptoms even more critical. The high mortality rate associated with this disease is often due to late-stage diagnosis. By sharing this information, we can collectively raise awareness. Please share this video with your friends, family, and social networks. The more people who know what to look out for, the more lives we might potentially save.